A national organization is jumping into the discussion concerning death rates in Crisp County.
Brianna Cook is live now with the results of a recent study done in Cordele and the powerful results it shows. Brianna?
Greg and Amanda, officials are sounding the alarms on premature death within the African American community in Cordele.
Graveyard that leads to Cordele, Georgia. One local citizen says that's a bad omen. Dr. Matthew Wayne is a pharmacist and physician who lives in Cordele. He conducted a study that has now been picked up by the Milken Institute, a national nonprofit organization. The study shows from 2009 to 2019, the lifespan of African American men was 60 years old, and African American women's lifespan was 68 years old. Dr. Wayne says he conducted his research after seeing a large number of deaths in his black community.
Crisp County, which is the county that we sit, is ranked 152 out of 159 counties in overall good health of the citizens. We have some of the unhealthiest citizens in the state of Georgia.
I then sat down with officials from the Milken Institute who say Dr. Wayne's study is absolutely correct. Dr. Victoria Cargill, the Senior Director of Health Equity, says when they dug deeper, they found even more health-related issues in Cordele.
We could really see significant disparities in a number of areas, including premature deaths, as well as child poverty, as well as the access to primary care providers.
Their studies found a staggering jump of premature deaths in Cordele, with a small number of those deaths being among children. They also found Crisp County's premature death rate is 2.5 times the national and state average. Cargill says lack of housing, lack of education, and access to health care all intersect to cause the higher death rates.
Individuals who don't have a higher level of education may have more difficulty attaining employment. If they have difficulty attaining employment, then the type of employment they attain may be employment that does not allow them the same access to benefits. And if you don't have the same access to benefits, then you may not be able to have the same access to health care.
During the study, premature death wasn't the only thing found in Cordele. They found the amount of opioid prescriptions are similar to those in West Virginia, a state that has similar issues to the ones they are seeing in Crisp County.
Look at what's happening in these populations. This is clearly a public health challenge. This represents opportunities lost, lives lost.
Dr. Catherine Sachs, Associate Director in Health Economics, says if local officials don't take action, the county will become deserted.
If you want to make your community attractive, it's not just, oh, we have a lot of job growth, but also this is a place where you can be healthy, where you can raise healthy and happy children. If people know that Crisp County is a place where you have awful health outcomes, you're not going to choose to move there. You're actually going to choose to move away.
This is a story I've been working on for several weeks, and I've reached out to several officials in Crisp County, but have received zero response on what their course of action is. But I will keep you updated. Reporting live in studio, Brianna Cook, WGXA News.